Hey folks, this is Ray Kober. If you haven't done so already, please click that subscribe button below. That'll help us get better guests and make the show better for you. So once again, click that subscribe button, join us for this journey, and together, let's make healthcare better for everyone.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and I'm here today with the lovely Naama O. And we're live from Ascend. Ascend, 10th anniversary from Ascend. Naama and I go way back. She's a buddy. She's a friend. She's an entrepreneur. We're going to learn about her many businesses and her holistic approach to healthcare, which I think we could all take a page from that book. So welcome to the big show, Naama.
Thank you.
It's
Wow.
great seeing you.
That's amazing, Ray. I mean, you surprised me. It's just such a scene
Yeah.
here. I mean, wow.
Yeah,
Wow.
no, it's so we go way back. It's been many years since we know one another, and I've told Naama frequently, and it's no BS. I learned transcendental meditation probably at this point 15 years ago, and I don't make it a daily practice, which shame on me because I should. But I've told Naama regularly is the host of a session where she leads the entire conference in meditation, and I've told you more than once, it's the best few minutes of my day. No, really, honestly. And I want to start there because it's not something that you, this is like ingrained in the fiber of your being. It's something that you cannot take this out of Naama and you can't take Naama out of meditation. It's something that goes together. When did you first stumble on meditation, and what was kind of the aha moment for you that kind of turned on the light switch?
Wow. Okay. So, first of all, thank you. I mean, it's been my life mission to actually implement meditation into our broken healthcare system. And part of me delivering meditation is because I'm an agency owner and have such a vast majority of influence on so many businesses, individuals, and we have a big department for Medicare in the office as well. I was delivering a broken system, as we all do.
Sure.
Which is not healthcare, it's just
Sick care.
Sick care, exactly.
Yeah.
So I did that for years, and then I started being on my journey of learn meditation in 1989, I would say 90 something like that, and then started meditating on my own. And then I really looked for something that I looked for help because I was very, very stressed. I was on my own in Los Angeles raising 2 kids in a really difficult marriage and was on the verge of losing my mind. So a friend was telling me, why don't you start yoga and practice yoga? It really helped me, and it was like 2000, late 19, just beginning of 2000 was actually got it.
Right.
Went for the first class, was amazing, and that's started my own journey. I became addicted to yoga. I admit, I've been on every retreat, every leadership, and everywhere that you wish in the world, basically. And then really started digging into the study of Ayurvedic medicine and yoga and the way, and basically yoga is the general conversation, but then you have the meditation and you have the breath that you have, it's subtitles. And for me, it was like, okay, I am now going to go to India. I went to India, and I was about to leave the health insurance industry because I said, how can I be happier, found the medicine, let me just lead that medicine and be the solution for the the yoga community,
Right.
and be a yoga leaders. I did modules of studying of yoga and yoga conferences, and so I was sitting in India, and already had a really big agency in Los Angeles, in California, and thinking
Insurance agency.
Insurance agency,
Yeah.
yes. And then thinking to myself, okay, I'm gone. That's it. I'm going back to LA, and I'm going to sell the agency, and I'm going to start teaching yoga. And all of a sudden, I had an epiphany. I was on the Gangas, and I had an epiphany, and I almost like it was a call. Is like somebody said, no. You're not going anywhere. How can you go? How can you leave your client? How can you do that? You're not going to do it.
And when
because
was this? What's the time frame?
This was 2010.
2010.
Yeah.
Okay.
So it was 2010, and I was deep into practicing myself and finding solutions for myself, which really helped.
Yeah.
And
So you found that it was a game changer for you. You know that you obviously you were living in a certain level of stress and tension, and I'm imagining, I don't want to put words in your mouth, but it sounds to me like you were not in a good place mentally, physically, and this was something that was a game changer for you.
yeah, when I found it in the late 90s,
Late 80s, early 90s.
90s, and then started really
Right.
digging into it in the 2000 was like I was all over, and then
2010 you were like, hey,
in 2010,
you
and
said,
I already raised my kids on yoga. I would bribe them. I said bribe them. No, I'm influenced them. I rewarded them. The reward, I engaged them.
Naama's an influencer.
I engaged them of like, okay, 4 yoga classes will get you these boots. I mean, I'm not ashamed to say, but my kids,
Right.
until today, by the way, my son is almost 30, my daughter is 28. They're both practicing all the time.
Really?
Yeah.
Wonderful.
Yeah,
That's
it's
that-
a tool. It's a tool.
So you bribe them, but but ultimately, it really worked out in the end, and now they actually love it. They learn to love it.
Unbelievable. So I had this moment, which, and I'm telling you, it's almost like God touched me and said, no, you're not going anywhere. Because I was really good at what I'm doing. I'm still good at what I'm doing. I mean, I can predict the market. I can help clients when I sleep.
Yeah.
Well, I'm literally, I mean, my heart is in, it's in the business. It's
Yeah.
in the environment, and now with the self-funded, and I'm like all about how we are moving the insurance industry, the fully insured, into finding solution, into bringing the conversation about the PBM, the direct primary care. I mean, I am all over it, because you can. It's almost like once you start learning and understanding,
You can't unlearn it.
Right.
You can't
and you and
unlearn
I
it.
know that, and
Yeah.
that's how we met, actually.
Yeah.
So it was, and then few things happened in India on this trip, and that I met some leaders in the space, and they were like, you need to do this and you need to do that, and I'm like, okay. I got the message. I came home, and then I started talking about, because I was on several focus group and community members for the insurance carriers, so I started talking to them about that, and they all loved it, by the way. All the leaders and the major leaders in fully insured, actually, with the Blue Shield, with Kaiser, with...
What were you talking to them about specifically?
I said we need to implement yoga and meditation into our
Work
system,
environment.
Healthcare.
Okay.
Yeah, healthcare system.
Yeah.
So I started doing that. They said, bring me proof, bring me the science, there was nothing. There was no white paper. I was researching, and there was none. So I started doing it on my own.
Mm-hmm.
I started implementing all my clients without even exception, cannot even hear more about yoga and meditation, I think, by now. I mean, but I started bringing it to employers. I was I curated, session for them. I would bring the expert. At home, I moved the playground for the kids for outdoor indoor yoga studio. So I started hosting gurus from all over India and from all over the world, basically healers and gurus and sessions. And
I'm sorry, you were doing this in India?
in my home.
In your home?
My home.
In your home in Los Angeles?
Remember, yeah.
Oh, okay.
So I used to have a playground.
Uh-huh.
And then in 2011, I moved the playground and just curated the space that it's been outdoor, indoor yoga space.
Wow.
Yeah.
Very cool.
Yeah.
And people came.
Oh my God. Sometimes I walk in the neighborhood and say, "Oh, I was in your home." I'm like, "I was in your house in a session." I'm like, "Oh, okay." I don't even know. I mean, it was open to community. I mean, it was. I felt like this is how I'm gonna give back and share with the community my love and my passion.
Yeah.
And this is also. And because there was nothing to prove as like what. Okay, this can lower cost of care. This is like there's no science,
Right.
So I had to, invent it myself. What happened is very soon after, in 2013, on one of my trip to San Diego, Yoga Journal used to host a retreat. And then on Friday night, they had a VIP speaker, which was Deepak Chopra. Dr. Chopra.
Dr. Chopra. He's the real deal, folks.
So, and then I never met him before. And I was driving to San Diego to make sure I'm on time, bought a VIP ticket. I was first row. He was releasing his book, Super Brain. So
Okay.
that was when he released his book. And it was 700 people or 800 people in the audience. He was super tired that night. And he was signing the books. And I was in line. Like I went to, talk to people. And then I came. It was impossible to almost like get to him.
Right.
But I knew I had a 2-minute span. And not only that, I was shocked. I was sitting there in San Diego. And he laid out the white paper of the first, study that the San Diego University with Mount Sinai in New York, with the Chopra Center, conducted research
Oh,
about
wow.
meditation, and it was like, what is going on? Here's the white paper. So I knew I had a minute or two of his time, and I said, I need your help. I am in the healthcare industry. I'm delivering this broken system. We are not delivering healthcare. We are delivering a horrible system.
Yeah.
Seriously, I mean, we're causing people to be sicker and sicker and sicker.
Sure.
And you and I know that.
Yeah.
So I said, I need your help. And he looked at me and he said, I'll do anything, whatever you wish.
Wow.
And, so he gave me his personal information. And I mean, it was more of a big daddy, like,
Yeah.
energy.
Yeah.
I didn't need, but that's for them. From then, I wrote 2 CE classes with their paper. One of them is reducing healthcare costs with yoga and meditation as one, and one meditation as a way for wellness, and start teaching and learning more deeper into that, and went through his coaching certification
Yeah.
in meditation.
So I'm sorry to interrupt you, but I have to share with you and the audience my Deepak Chopra story. So I've been married now, it will be 35 years. And anyone out there who's listening knows that there's no such thing in a straight, smooth line in marriage. It just doesn't exist. There are ups and downs. And listen, there are times in my life when I was a jerk, I was an asshole, and if it weren't for the strength of my wife, we probably would not be together. It's God's honest truth.
Wow.
But one thing that really helped me was I read a book that he wrote called The Path to Love. And amazing book. And essentially, if I could summarize it in just a sentence or two, what I learned is people that are in relationships always make it about the other person. And it's not about the other person. If you don't find inner happiness and inner joy and you don't find it within you, then switching over and jumping to a different partner is not going to solve the problem.
Correct.
Now, that's not to say that you're in a good relationship or the perfect relationship, but for me, it really was an eye-opening aha moment, and I said, you know, if I want this to work, I have to put in the work. And it was really, and just reading the book was incredibly helpful to me. And listen, I'm not going to lie, there was marriage counseling involved. But I think if you really want, and if you really, you know, are serious about saving a marriage, or just, you know, saving might not be the appropriate word, but just helping you through a rough patch, right? I think you have to be willing to do the work, and it's more than just therapy or counseling, at least for me it was. And reading that one book made a huge difference. So I saw him, because Naama and I, we share a couple of things in common. One is the love of crypto and V Friends and Gary V, and we went out to the VCon conference, and Deepak Chopra was the speaker there, and I saw him, and I chased him down, and I thanked him because I really do believe that he was a big piece of just me getting my mind right, and it helped my marriage in a huge way. So he's an amazing guy, and to have someone like that basically embrace you with his energy and his love is just, that's got to be amazing.
I mean, and then another layer, you know, I figure and I realized that I actually was trained by, he didn't even have the center yet in La Jolla back in the days, you know, when I was trained, when I went through my certification of the you know, the
La Jolla
course,
is one of the most
primordial-
beautiful places on planet Earth.
Yeah.
San Diego,
For
amazing.
Sure, for sure. So the primordial sounds meditation,
Yeah.
that was how I was actually learned how to meditate, and it was based on what him and Dr. Simon back in the days wrote, and the philosophy. And that's what, when I teach, you know, the C-suite or the executive how to meditate, and with the certification and all that, I mean, I always remember that this is, I truly believe in that. I invested in heart and soul, and also I feel like I had to reinvent how to move it into the healthcare industry, especially when leaders care about the lowering cost of care, the quality of care, and the way we deliver it, you know, and reducing cost and delivering these checks that Nelson is talking about,
Right,
for the system that, you know, it's now available, and it's amazing. Also the captive, I really love captive.
So I want you to unpack, you said it was a certain type of meditation, and what did you call it?
Yes, so it's called Primordial Sounds Meditation. There are 108 mantras, and we are not supposed to share our mantra. So you and I can have the same mantra, but we're not supposed to.
You're not
share.
supposed to speak it,
but yeah,
right?
say it.
And why is that exactly?
Because it's sacred.
It's sacred.
There is a level of sacredness, and I think that's really comes with the territory. And
but if you lead a group session, then you say a mantra.
I lead the group session. Let's say there's 20 people or even more. I mean, and then each and every person I lead into ceremony, a half an hour ceremony, one-on-one,
Right.
for the actual gifting of the mantra.
Mm.
And the mantras, the Primordial Sounds meditation mantras, based on the time of your birth, the date of your birth, and the place of your birth. So it takes you back to the first moment of inception, like with the first breath.
Oh, wow.
And that's where we want to do. We want to bring ourselves back, because this specific breath that we took when we just first came out of the womb, you know, that was whole. It was whole. It was complete.
Right.
It was no condition, no, you know, and we want to remind ourselves
Yeah.
deeper and deeper that this is the possibilities. And listen, I mean, this morning I was talking about karma, and because Tuesday, and this is also based on a book by Deepak Chopra, is the 7 Spiritual Law of Success, which is also go to the Bhagavad Gita is I always having a hard time. And all the philosophy of the medicine, it's always talking about how can we go back to the wholeness, and basically that's what we're trying to do. And it's very simple. I mean, I think that people are using it now. People talk about mindfulness, and but when I come as the mindful officer for companies and organization, I keep it simple. I make sure people just understand that we want to lead by example.
Yeah.
We want to lead in a way that we want to make sure that people are like spending time, few minutes.
Yeah.
Few minutes. Doesn't take.
So this may be a risk. Is it possible for you to lead the audience right now in a 1-2 minute meditation?
Of course.
Yeah?
Of course.
So why don't we do that?
Yeah.
And this is a little unusual. It's a podcast. Listen, if people want to skip ahead, they could skip ahead. If you're driving, please be safe. You might want to pull over for this.
For sure.
But
yeah.
she's wonderful, and
Yeah.
I think it would be a great gift to our audience.
Absolutely.
Lead us in a brief
All right.
meditation.
Okay, so wherever you are, I suggest we all close our eyes. So let's close our eyes. Let's sit comfortably and feet on the ground. There's no specific position. So we're not attached to any possession, or any kind of specific way of being and doing. It just let go. Let go of your day. Just relax your feet. Relax your knees. Relax your hips, your shoulders, your head. Just be relaxed. Feel the peace in your body, peace in my soul, peace everywhere. And let's take 3 breaths together. Huge breath. Inhale and exhale for the body. And then another inhale and exhale for the mind. And then the third one, inhale and exhale for the spirit. And just smile. Feel the love. Feel the connection. Continue inhale and exhale. And let's mentally ask ourselves, repeat to yourself, who am I? Who am I? And who am I is not a possession or position. Who am I is infinite possibilities. Who am I? As I explained earlier, the 7 spiritual law of success we practice Tuesday is the day of karma. And karma is our past actions that lead us to where we are today. And we are, most of the time, doing it mechanically without even thinking that we can change and move into a different path. So breathing is one of it. And we are a very shallow breather. So inhale and exhale. Inhale and exhale. Then we move into mentally asking ourselves, who am I? Who am I? Who am I really? And who am I can change, can be different every day. Who am I? Who am I? Don't be attached to any answer, just let go. And then move into the third question and mentally ask ourselves, how can I serve? What can I do? What is my purpose? What is my purpose? What is my dharma, which the next 10 years will be about? Who are we showing up? How are we showing up to each other? Who is me that's showing up? And what is the purpose? And let go of that question And the last one will be, what am I grateful for? What am I grateful for? Mentally ask yourself, what am I grateful for? Every day, every day. And the list can be long: my health, my well-being, my community, my significant others, the community at work, my employees, Ascend, which is now happening, which is really amazing. What am I grateful for? I am actually grateful for Ascend and Nelson, of the work he was doing for 10 years. I'm very happy to be here, celebrate the 10 years. And then we move back into our bodies, and then let's meet in the heart. Maybe we can imagine the color green, spine is straight. When we straighten our spine, we are open our heart. It's easier for us to accept and also to give. And then mentally repeat to yourself, loving, compassionate heart. Loving, compassionate heart. And just let go and know that love can heal. And if we spend time every day, a few minutes, going back to stillness, quiet space, breathing, we are implementing perfect health and healing. And when you're ready, you can open your eyes and feel the difference.
Wow. That was amazing. I came in on not the red eye. I'm going home on the red eye, but I didn't get to bed last night until probably 2:30 New York time. And so I'm running on fumes, and that little bit, that little session made a difference. I feel better already.
I know.
It's amazing.
I know.
So this is really what you're passionate about, and you do it so well. And truly, like, if you give it an opportunity, it's like anything in life. If you discount it and you're mentally checked out before you begin the meditation, then why even waste your time? Don't do it. But if you're open to it and you're open to doing something a little different and you really put your mind in it, it's amazing. And I guess there's a reason why you bribed your children with doing 4 yoga sessions and meditation. It really does make a difference in your life. How has it changed you?
So, first of all, it's very hard to say or influence someone to meditate unless you do it yourself.
Yeah.
So you have to show up, and this is not an intelligent practice, and it's not a destination.
Yeah.
So it's a journey, and you don't judge it. You just you show up, and just make sure it's a discipline.
Yeah.
We have to put it on our schedule. Now, also, I think that what it did for me, it increased my focus. It increased my happiness. Happiness is not something we can buy.
Yeah.
We can buy medicine, maybe. We
Sure.
can buy a lot of things in life. But happiness, it's really something
It's a state of being.
happiness, positivity, the actual act of kindness, compassion, it's opened my heart, even way more than I ever.
Yeah.
Before I never had a condition that I need. People start meditating. I get people reach out to me when they are reaching like the bottom of health and just either a loss or a health situation,
Right.
or chronic disease, because it shows. There is science now that shows that it can lower the blood pressure. It can lower, the everything.
Sure.
Diabetes. It's not a solution, end of solution, but it helps. Not only that, I think if we are going to put stations in a surgery room, in the waiting room for the surgeries, or emergency room, and we put guided meditation. Now that we have AI, it's no-brainer.
Sure.
And then we can teach the healthcare industry more and more, and that's what I'm doing. And now thank God, the last few years I have brands that join me and actually helping me, because you need to have the budget for that.
Sure.
You know? So when I do the branding and helping companies brand into the healthcare industry, that's something that they actually see as value,
Yeah.
and bringing it to the consciousness of people when most of us are unconscious.
Amazing.
You know?
So yeah, I mean, you're really focused on health care as opposed to sick care, right?
Oh, yeah.
It's about having these disciplines that you make a part of your life so that you live a healthier life mentally and physically. And what would the end result of that be? It's pretty logical, right? The end result of that should be less of a need to lean on the healthcare system for medication and interventions that only kind of treat a symptom but don't treat the root cause of the problem.
Exactly, but we also need to move the responsibility from the insurance carriers,
Yeah.
or either from the employers, you know,
Yeah.
to us.
So the Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com. So talk to me a little bit about that, because Naama's an incredible entrepreneur, and I know that you're involved in many, many different things. But if you had to break it down simply for the audience in terms of what are your businesses, what are they?
So I have Paz Holding, and Paz Holding is the corporation, and it's overseeing all the rest of the divisions.
Right.
So this is basically embedded everything else. So under Paz Holding, you have Right Plan, which is the right plan for your coverage.
Right as
for
an
the
R-I-G-H-T, right
yeah,
plan?
Exactly.
Okay.
You know,
That's
it's
pretty simple.
I know, it's rightplan.com.
Right plan for you.
I mean, it's a right plan. Yeah. What's
Right.
the right plan?
Right.
And it's actually a division that were born from A Plus Insurance. So
Okay.
A Plus Insurance was more of the traditional health insurance agencies
Yeah.
with all the individual. We are also storefront for Covered California, so we offering that private insurance, Medicare, and benefits for employers traditionally. And then Right Plan is more of what is the bigger picture? What's the overseeing of the healthcare industry? Moving the conversation about the self-funded, how can we move the fully insured for the self-insured, you know, I mean, how are we going to bring the conversation about the PBM, the primary care, direct care, you
Right.
know, I mean, the solution that will engage employees to actually take care of themselves and move the oxygen and breathe and do the work they can do. Because if you are doing the work, and it's easier said than done,
Right.
but I think that we find ways to, and that's why you need to bring the live conversation and remind everybody mindfully that they need to move to the present. Most of our stress comes from living in the past or living in the future.
Right.
We are not human being living in the present moment.
Especially with all of our devices and connectivity.
Right.
We're somewhere else.
So hard.
Yeah.
So if we're not going to take action towards that, it's going to be a problem. So that Right Plan is moving the industry into the conversation, into finding solution, into bringing the captive of the world, and the conversation of how can we reduce cost of care, what's the solution the employers can have, and individual as well, because for me, in my world, it should be self-funded solution for individual as well. If I want to self-fund myself and I can buy a stop loss, we should have a pool of risk for people who would like to form it, and that's why I love the blockchain, by the way.
Yeah.
Because that's where the blockchain comes in, and I am an artist.
No.
No, I mean, from all I do is I was born an artist. It's
Right.
funny because, you know, it's
You're
like,
not a construction worker?
I don't know, but I was born an artist. You know, I was painting
Yeah.
since a very early age, and I stopped painting in Around, I would say 1995, something like that.
Okay.
Around that, no, maybe later, maybe.
You were painting like oil paintings, murals, big stuff, small stuff?
Big stuff.
Big stuff, like
acrylic.
big walls?
Yes.
Oh, wow.
And I stopped because
Okay.
I don't want to sell. It's not my career. It's like I'm like, okay, this is it, you
Right.
know. And that's how I'm talking now about let's get phygital. Let's move the physical into the phygital, the digital space. And what happened to me, the first, and I was against crypto.
Okay.
My son went to Berkeley. He started grinding my energy, like please, Ima,
Mom!
you need to, yes,
Yeah.
you need to
It's
make
the
sure.
future.
Yes, it is, and I'm like, I understand, but it's mining, and I'm very conscious about the environment. I'm trying to be. I mean,
Right.
I'm not even
Yeah.
halfway where I want to be, but it's just I'm consciously making decision about
Right.
the environment that will help the environment
Right.
because I feel like, I mean, that's me for many years. But this was, I'm like, I don't want to waste canvases, and I don't even have a basement in LA, I mean, in New York you do have, I don't have a basement.
Right.
So was during COVID when I was on Clubhouse, when the first ever room about the NFT, the non-fungible token, started. The conversation they're still, by the way, a very good friend of mine. And the first minute they explain what is an NFT, and what means to have an digital art.
Yeah.
I hadn't. This was another. It was 2010, and it was then, and I'm like, I got it.
You got it.
The same night,
Yep.
I bought crypto. I went all in. I'm like, okay, that can make a difference. And right now, I mean, I didn't sell any of my art on the digital world because I'm still I feel like for me it's not the hype and it's not the
Yeah.
for me I have a major career and I'm doing so much, but I donated a lot and
Okay.
I've been part of a very major project in the crypto and the NFT, and I became the unbelievably advocating, especially for women, because I feel like the blockchain and the crypto is like we're going back to the 1920s. Even, I mean,
It's the theme of the conference.
Ruth, I
the
know.
Roaring 20s.
I know. It's
Yeah.
Ruth, but they will probably scrolling in her grave because it's that. I mean, women. There are women in the space.
Yeah.
The problem is not having women in the space. It's just show me the money. Who owned the wealth? Who owned the behind the scene? Who call me and say, "Oh, Naama, there is a project here.
Yeah.
Invest here. Invest." Nobody.
Yeah.
So I mean, for me, advocating for women, and again, coming from a business world, not as an artist, trying to make it into the business world. I think it's all the way around, and the combination between the healthcare and the health insurance, the possibilities, it's all combined together with the message, and that's why when Gary V came on Clubhouse with his series, it was, I knew it's going to be like
Yeah.
huge.
Yeah.
I knew, and it was, but once, just to say, to keep the record straight,
Yeah.
when I saw you, so I'm walking into a Gary V conference, the first conference,
Right.
was in Indiana or Indianapolis? I
In
think
Indianapolis,
or Minneapolis.
Minneapolis. It was Minneapolis.
Yeah, it's
The
back-
Superdome.
Yeah.
Yeah.
I'm walking into. Actually, it wasn't even it was an outside event. It was.
Right.
It was.
We just our paths
all of
crossed in like a
sudden-
rooftop
and
bar.
all of a sudden there was a party, and I'm like,
Is that what?
is this Ray? I mean, Ray for
It's like
me.
Naama.
Ray for me is in the insurance industry and the
Right.
benefits. And it was such an amazing moment for
Yeah.
me because I mean, I'm still. I don't think we have anybody. I mean, I've been traveling to the Bitcoin conferences a lot.
Yeah.
In the last 5 years, actually, since 2021.
Okay.
Yeah, it was my first 4 years. My first Bitcoin conference.
Yeah.
Before even Bitcoin offer art on the chain on the blockchain.
Sure.
But I really feel that we are lagging on the conversation, even here.
Yes.
This conference, for example, is for innovators, it's for leaders in the,
Yes.
in the industry, and I feel like we need to bring more of the conversation of how can we implement the compensation.
Right.
How can we the payment system.
Yeah. Yeah.
Simple. How can we pay claims? How can we move the technology and transparency? And this is transparency on
Right.
steroids.
Yeah.
know?
So for folks that really aren't plugged into crypto and what the possibilities are, and we are still in the infancy, right? Even though Bitcoin is above $100,000 now, there are still folks that are very pessimistic about it, and they look at it just kind of through one lens. And the reality is, it is a multifaceted technology, and the blockchain has got incredible implications for healthcare. And so I'm not sure that I'm personally sold on an NFT as a piece of art if we're talking about, I guess ultimately it is up to the market to say what any work of art is worth. And if someone wants to pay $1 million for a banana in a frame, they can do that. And that's a true story. There is a banana that's hanging on someone's wall and someone's paid a large sum of money for it.
He actually ate it. He
Right?
also ate it.
Yes. And so at the end of the day, though, if we forget about all of the government and politics surrounding
Right.
crypto,
Yes.
if we boil it down to the technology, the one thing that is incredible about it is immutable. It's an immutable ledger, and every transaction is recorded. And so how does that apply to healthcare? Well, healthcare has got so much opacity, and you can't trace anything, and everything is hidden.
Yeah.
So now if we have the blockchain and we can have a system where every single claim dollar can be tracked, every single prescription pharmacy
Transaction.
dispensed, every transaction is there for the world to see, then that's exactly what we're at Ascend for. We're at a conference like this
Yes.
because we are champions for the underdog.
Right.
We don't want our fellow Americans getting taken advantage of by the system. And who's the system? It's the Bucas, the Blue Crosses, the Uniteds, the Cignas.
Which I love them. By the way, I
Aetnas.
love them. Thank God for
No,
every carrier. I adore every carrier. They're working really hard, to do their own best job.
There's a place for them,
Exactly.
for sure.
Exactly.
But there are so many people out there that are struggling because their employer is doing it wrong. They are saddled with these high deductible health plans that first dollar of coverage, they have to come out of pocket $2,000-$3,000 before they have access to health care other than a primary care visit, like a regular checkup. Folks, that's called functionally uninsured, right?
Exactly.
And so there is a better way for, I'm going to go out on a limb and say the majority of employers and organizations, as opposed to the status quo system. And the status quo system is working just fine for those entities and their shareholders, but blockchain
Right.
is something that can be a game changer. I haven't really seen the innovation yet. I've seen certain AI applications that look pretty good. I've seen here and there little pieces, but I haven't seen anything that's really brought it all together yet.
But you know why? Part of it is because of our resistance.
Yeah.
So can you imagine if every conference, innovative conference, that we in the benefits industry will start the conversation, will bring the expert. There is a gap. There is like they speaking among themselves with everybody agreed, and we are speaking around us, so we don't learn anything new to adapt, and we need we need to adapt, and nobody asks you to keep your compensation or your claims or payment for the providers or the information in coins. You can move it immediately to fiat, but the system, it's way cheaper to run. It's saving so much chaos. It's also have the opportunity to actually expose. For example, there is a treatment, special treatment that they come out for, I don't know, for specific cancer in Africa. I don't even know where, you know.
Right.
I mean, in China, in Russia, wherever it is.
It's a big world.
Yeah, you know, I
Yeah.
mean, I want to know about it, and this is the problem on the blockchain. Is once you have an information, this is it. You
Right.
cannot, and this is something that online, it's almost like you can tweak your information and do whatever you wish. No, here is authentic.
Right. It's immutable.
It's current. Yeah, mutable. Yeah, exactly.
Yep.
And it's also, I think it's inevitable because if we are talking AI
Yeah.
and technology,
Yep.
and we're bringing that solution, you have to have a digital currency. You have to use a digital currency, especially in the healthcare.
Yep.
So I know we are the very late bloomers, and very. It's hard for us to adapt.
Yeah.
But you know, if I can can you imagine 40 years ago if I would have the information that meditation can lower stress, can lower blood pressure, can lower everything possible, can increase your focus, can make you happier, and this was available. And I would say, before you take this medication, I always say you either medicate or meditate. You know, I mean, it's like, and so many times
Yeah.
I partner with the PBM and the prescription companies because it's like that's what it is.
Yeah.
Either you meditate or medicate. So I mean, if you teach kids from very early age, I look at my kids; they're not perfect.
Right.
Way from being perfect.
No
you
one's
know?
perfect.
No. But I'm
Yeah.
saying I'm not trying to paint any perfection here, but they're solid.
Right.
There's something solid.
They're grounded.
In their heart and soul, and they know they have themselves because it's all about us. It's all about nobody else can really help you.
Yep.
And also, I must tell you, in healthcare, that there's two major cost-driven, and you know it, and I know it. It's the premature babies
Yep.
and end of life.
Yeah.
So, how to die, how to end up our life, how to basically move in transaction from life to death.
Yeah.
I mean, we are on the process of dying, not only on the process of living.
Right. Right.
Just by having a conversation and education about that,
Yep.
which I think that's in the yogi tradition, that's what I love very much about, because they are speaking about it. They are breathing it. They are celebrating it.
Yeah.
You know, I mean, they are talking about it. There's no fear.
Right.
So there's a lot of fear medicine when end of life is happening.
Sure.
And people do not know what to do, how to approach it. So if we can start conversation and understand and education about it, which the blockchain can also help, the technology can
Yeah.
help.
Yeah.
I mean, we are going to see less and less people also holding on when they should let go.
Right.
And we are going to feel like we are ending our life. It doesn't matter how old we are, but that's the end of life. You know, and that's what and I believe we're going to live longer. I think with longevity, conversation about longevity,
Sure.
and how can we increase our lifespan.
Yeah.
That's
Well, my feeling is not that life is overrated. I think life is a precious gift, but life is not the end. It's life as we know it in this physical sense, in this body. There was something before it, and there will be something after it.
Absolutely.
And if you don't believe that, then okay, you believe what you believe. But I personally, I am of the mind that there was a before and there will be an after. And while we're here, let's do the best that we can with what we have.
1,000%.
Mentally, physically, and I think that goes hand in hand with meditation. It goes hand in hand with yoga practice.
Food.
The food that we eat is a
choices,
huge piece of it.
Just a hot water with lemon can change your life.
Yeah.
Seriously. I mean, it does changing mine, you know. It's keep changing mine all the time.
For sure. So how do folks get in touch with you if they want?
So, first of all, LinkedIn.
Yeah.
LinkedIn is great. Naama O Pozniak. You know, I mean,
Spell
it's
that for folks.
last name or Naama.
Okay.
Then middle initial is O. It's part of my name. O. O means light in Hebrew.
Oh,
so it
wonderful.
is part
Beautiful.
of my name. You asked me.
Yeah.
Yeah. And the last name is Pozniak. P-O-Z. P like Peter, O like an orange, Z like zebra, N like Nancy, I like I am, A like an apple, K like Kobe, Pozniak.
Excellent. Excellent.
So on LinkedIn is the best, but you can always reach out to me. Rightplan.com is the Right Plan website.
Yeah.
Let's Get Phygital is a whole different project, and I speak also in a lot of crypto conferences and NFT, and I just been in Lisbon, in NFC Lisbon, we're there. I also lead meditation in these spaces, but speak about wealth and security and how can we move the conversation of healthcare and well-being.
I love it.
Yeah.
And listen, if you're, someone who is listening to, the podcast or you catch it on YouTube, connect with Naama, because really if you're an HR leader, you're the head of people, maybe even you're a CFO that's looking on getting a handle on finances, the health and well-being of your people are everything, and they are most definitely interrelated. And so I think there's a huge opportunity honestly, for you to make a difference in the lives of folks that embrace this and engage it.
I know, and you know what makes me most excited is like that doing it for brands now, and especially brands in the healthcare industry, and partnering on the mission, but through that exposing brands and startup into the healthcare industry.
Mm-hmm.
I cannot even believe myself how well it's received and how well we are enhancing and growing, and it's like incredible. So I mean, I think if you are a startup and in the healthcare industry and needs platform into the employee benefits, self-funded, lowering cost of care, innovation, technology, all that, I think that's
right.
An amazing partnership. Yeah.
Right on. Well, hey, I've learned a lot. And how do you say it? Namaste.
Namaste.
Namaste. Namaste.
Thank you for having me. It was
Naama O Pozniak.
Yes.
It has been a joy and a pleasure.
You.
Thank you for leading our audience in meditation. That may be a first ever on a podcast. I don't know. I don't want to be that bold, but I hope you enjoyed it. If you were in a car, go back and re-listen and re-watch and do that again. It'll make your day a little better.
You. But thank you for doing it. You are such a professional here.
Oh, stop it.
I mean, you guys should see it. It's like it's a no joke.
I'm a frustrated artist, and here I am. All right, folks. We'll see you on the next one. Until then, love always. Take care.
Take care.
Bye-bye.
Yeah.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.